Clinical trials are scientific or medical studies of human beings that are done to look at new medications or sometimes new medical devices for treating diseases such as diabetes, high blood pressure, stroke, cancer, or in the case of medical devices, looking at devices such as heart implants or hip replacement or knee replacement medical devices for people.
Basically what it is trying to answer a question that was raised by scientists who have tried something for treatment or prevention or screening of a certain disease. So what they do is try that out and try to answer a question on animals and in labs, and if they get a positive result, then they move to the next step and try to get it on human beings. So it's basically research study that involves people.
Well, there are different types. There's a treatment type of trial where they would look at a specific type of treatment to see how that would work perhaps on a specific disease or series or different diseases.
It's either a new drug or it's a combination of drugs where they try to improve the way of treating that disease.
There's prevention that might look at what sort of things could be done to prevent disease.
And this could be vitamins, could be immunizations, could be minerals, could be several different kinds.
Do we find if we do a clinical trial to see if screening for diabetes earlier in some people might help to prevent eye diseases? And screening clinical trials would be clinical trials like, well, how often should women get mammograms, or how often should men and women over the age of 40 get colorectal screening to, again, for each disease, see if we can better prevent or screen for breast cancer or colon cancer, or in men, how often should we get prosthetic antigens or PSA blood tests to see if we can better screen for prostate cancer in the earlier stages for men.
And then there's quality of life trials, which would look at perhaps quality of life issues particularly with chronic diseases such as diabetes, heart disease, to see what sort of quality of life issues people may have if they have those types of diseases.
Medications tend to act sometimes differently between different genders, different ages, and same thing for races and ethnicity. So it acts differently, and what happened is most of the clinical trials were done on whites.
Minority participation in clinical trials has been, unfortunately, not as inclusive as we would like. Unfortunately, there have been various things such as mistrust of the medical community and the minority community, which has promoted that.
And throughout the years, about 1999, there was a study that was released about, although minority makes 1/3 of the population, only 8% had participated in clinical trials. Only 6% were African American, 1% Asian, 1% Hispanic. So basically there is not a lot of minority who are participating in clinical trials, and because sometimes a minority tend to respond differently to different medication, if we don't have this data, we will not be able to say which medication works better on certain people.
Like anyone else, minority participation in clinical trials is very paramount and key, because you want to get the best results for the best treatments or medications. And if you don't have minority participation in clinical trials, a lot of excellent clinical trials do not have the requisite or good number or good sampling of people to fully test a drug to see how good it's going to be, and not just people of different races, but people of different genders, men versus women, or people of different ages. Is it healthy in someone who's a 30-year-old as opposed to someone who's 70-year-old? Or is it safe in children or not? And in that way, you need the appropriate representation in clinical trials in various medical specialties.
There are 4 phases, and basically there are different phases. The phase 1 involves healthy people.
Typically the first phase involves healthy volunteers, and basically in that phase a human being, and there's usually between 20 and 100, are going to get a new drug, and it's basically to see how the drug is tolerated in the body? Is there nausea? Is there lightheadedness? How is the drug metabolized through the body? Is it excreted through the kidneys, the liver, or the bowels?
And phase 2 and 3 are, the period for these phases kind of differs between one phase and the other, and the amount of people you recruit is different from one phase and the other.
The second phase of clinical trials, again, is a little bit more in depth, because now it gets into, well, is this new drug good for treating diabetes? Is it good for treating heart disease? Is it good for treating stroke victims? And you get into, in phase 2, well, what is the safe dosing range for using this drug? And again, what are the side effects? And how is the drug, again, metabolized through the body? The third phase of clinical trials is the phase where, the drug, you're looking at how safe and effective is the drug for treating a particular disease. You're looking at indications. Is this drug good not only for diabetes, but can it treat other diseases? For instance, certain seizure medications we neurologists found can be good for treating as well chronic pain. So you're looking at other indications for the disease, and you're also starting to look at, well, are there any special populations is it good in? Is this drug good at treating depression in the elderly or depression in children? Or is it good for treating diabetes in young adults or older adults?
Phase 4 usually after the the medicine is released to the market, and this is a kind of the longer phase of the clinical trials.
It is important sometimes that a minority patient, if they have a minority healthcare provider, sometimes that adds a level of trust that would make a patient perhaps want to consider participating in a trial that they may not otherwise think about. As far as what the Wayne County Minority Health Coalition is doing, we are one of 4 counties that's working with the Indiana Minority Health Coalition on the clinical trial initiative. And right now we're really working in a public education and awareness to make physicians and potential participants aware that clinical trials are out there, and to see what they want to do and participate, if they're interested in getting more information on clinical trials, and to act as sort of a liaison and information for them on that subject.
And when we did a study by the Indiana Minority Health Coalition, we did a survey on Black Expo in 2005, and we asked the community, who do you listen to about, to learn more about clinical trial? Who do you whose advice do you listen to? And the number one answer was their healthcare provider. So basically, we're trying to talk to healthcare providers also to involve them in clinical trials, and to encourage them to talk to their patients about clinical trial and consider it as an option in their treatment.
Well, there are several barriers. I think some of them could be due to our location, and some of them are just barriers that may exist because of attitudes and beliefs. There is a lot of mistrust about previous clinical trials that perhaps were not conducted appropriately years ago, and so there are a lot of people that still know and remember these things, and that is a barrier, just that attitude of mistrust.
Well, in the African American community, and I'm sure you may have heard this, the Tuskegee syphilis experiment was a 40-year experiment from 1932 to about 1972, where rural, poor African American males in Alabama were deliberately not treated for syphilis. And over a period of 40 years, a lot of those men died, or if they married and had children, they passed on the disease of syphilis to other family members, and certainly some children were born blind or with neurologic disabilities. Some of the men themselves who lived with syphilis a long time died of the ravages of syphilis, which can include, again, dementia. And it was very sad, and it certainly, at least in the African American community, created a very severe climate of mistrust of the medical community.
Sometimes lack of transportation could be another barrier. Sometimes childcare, sometimes religious belief and cultural belief that this is what God had for me, and this is where I'm gonna I'm gonna accept it, and that's it. So these are some of the barriers, but I think every one of these barriers can be we can overcome these barriers by talking to the patient and informing them about all these information and how they're protected, and how hopefully the experience of Tuskegee will not be repeated again.
Well, we actually, we are not participating in a clinical trial in terms of being a sponsor or anything of that nature, but as far as any information that people give us, if they want to become a part of the database that the Indiana Minority Health Coalition is making, we make sure that all that information is kept confidential. They are not subjected to being put on a mailing list and receiving a lot of unsolicited advertisements or anything of that nature. We would send the information that they give us to the Indiana Minority Health Coalition, and then that's basically they are consenting to be informed about clinical trials on whatever disease issues they may have going on, or even if they want to be used as a healthy subject of a trial. And then we would not release that information to anyone.
The Indiana Minority Health Coalition is a non-for-profit organization which was founded in 1992, which was founded on the basis of a Secretary of Health Heckler's report on minority health in the United States. And its role was to decrease health disparities in the minority populations throughout the state. And the clinical trial initiative is one of its health disparity effects, because since minorities aren't as representative in them, there is a health disparity on their getting the appropriate representation and early treatment. Our clinical trial initiative has 4 parts. The part 1 is geared towards the public and healthcare providers such as doctors and nurses, and it's to increase awareness and education in clinical trials. It's also to encourage healthcare providers to want to learn about clinical trials and possibly get them liaison with people who can teach them how to do clinical trials, either out of their offices or various hospitals.
The other thing, we're trying to build a database. If we do a presentation and people attending are interested in receiving information about clinical trial about diabetes or about hypertension or any clinical trial, what they will do, they will fill out information, give it to us. What we do, we keep it in a privacy protected database, and when we found something that matches their interest and currently happening in Indiana, we send the information to that person, and it's up to him or her to contact the pharmaceutical company or research organization. So we're not releasing any name, we're just kind of giving information to people. The same thing we're doing for physicians and healthcare providers. We're trying to go out in the community, we're doing all these presentations involving the physicians, sending out letters. If they're interested in being in our database, again, they send us their information. If we find a clinical trial that matches their specialty, we send the physician the information, and it's up to him or her to contact the research organization. They can be a source of referral only, or they can be themselves as an investigator. That's the second goal.
The third part is more of an assessment piece where we do clinical trial surveys to assess physician, nurses, and equally importantly, minority community attitudes towards clinical trials. We want to do focus groups to see what physician and other healthcare providers' attitudes are towards clinical trials, to see if there are any barriers that we can help or any educational matters we can help with them. We also, in this part of the trial, get involved with health fairs and others, and we assess, our participation and what we learned. And what we were able to help others learn.
The fourth goal is we're trying to be the liaison and the middleman between the patients, the physicians, and the pharmaceutical company. If there is any problems that may be happening in between, we will try to solve that. We're trying acting as a middleman. We're trying to solve whatever issue comes up, and we're trying to ensure that physicians don't lose their patients because of clinical trials. We're trying to ensure that physicians will maintain their patients, and a lot of physicians are hesitant, or healthcare providers are hesitant to participate because of some of them, they may think that they may lose their patients, but we're trying to be the middleman and make sure that they won't lose their patients.
We want people to be interested and be open to learning about clinical trials, because awareness and education is always the key.
To contact my office, they can call at area code 973-8788. Our office is open Monday through Friday, 8 a.m. until 5 o'clock p.m. And I take voicemail messages at any time. So if anyone is interested in serving on our local advisory board or is interested in finding out about clinical trials, I'd be happy to talk with them. To contact the Indiana Minority Health Coalition, the number there is area code 317-926-4011, and at extension 245 they can reach Layla Baker. At extension 284 they can reach Dr. Karen Rodman.
You know, we're trying to let the word get out. We're trying to let you think of clinical trial as an option. Put it, ask your physician, ask your healthcare provider about clinical trials. Is it an option for you? Is it something you can participate in? And clinical trials can be also for healthy people. If you are interested in, being in a clinical trial, some of them are, looking for healthy people. So there is always an option that you can help.